But to tell you the truth, I'd rather not stand up, talk with the microphone, and see if I can come down here. Can you all hear me? Yeah, microphone, can you hear me? Good stuff. So as you can see, my talk today is on Ebola. And down here at the front, you'll see these lovely people who are actually my board, the PhilSoc board. So if you have any questions, be sure to ask them after the talk. So there is an outbreak in the world, and that outbreak is Ebola. And we've all heard about it, we've all read the newspapers, the Daily Mail for some of you, the Times, the more highbrow of you. But the question is, where did it all begin? And where better to begin than the beginning? And what you're looking at here, the blue region, is the Democratic Republic of Congo. And Ebola takes its name from the Ebola River, which runs through the center of this region. So it began right about here and steadied. And then from there, obviously, you get infection, hospitals, and today you see it primarily here in the west coast, Liberia, Guinea, Sierra Leone. So the first outbreak was recorded in about 1976. So the disease, although it's got a lot of hype today, isn't as recent as you all think. It's been around, it's been lurking in the corners. Only today has it become such a drastic issue. And when it first broke out in 76, a report with hello there at the back, nice of you to join us. In 76, the World Health Organization, as you know, which is a sub-body of the UN, or the WHO, any of you? The WHO, on the 25th of October 1976, released this 24-page report entitled Ebola Hemorrhagic Fever in Zaire, which is the sort of region within the DRC where it first appeared. And as you can see, it has 280 deaths, 38 survivors, and approximately a 14% survival rate. Now, just to give you an idea of how small that survival rate, today, every year, 331,487 people, that's a rough approximation, contract cancer of some sort. Of the people in the United Kingdom that contract that cancer in whatever form, pancreatic, testicular, breast, 50% will go on to live 10 years. That's a very high survival rate. With Ebola hemorrhagic fever, you're lucky to last a week. So today, the outbreak began last year actually, so relatively recently, in December of 2013. And it's estimated to have begun in Guinea this time, which is somewhere over here. I think it's just down the picture. You'll have to forgive me, I dropped geography in year 9. But it was that bad, this outbreak, considering that there were, so far have been 3,967 cases and 2,105 deaths. That's to date. On August the 8th, it was designated by the WHO, this time the real WHO, the World Health Organization, as a public health emergency of international concern. Now, that is a level of emergency which has only ever been activated twice in the history of our planet, considering the UN, its predecessor, the League of Nations, etc., etc. And that was only activated for these two diseases. Man on the right, as you can tell from his shriveled limb, suffered from polio at some point, probably during his youth while he was most vulnerable. And assuming that he was in an LIC, Malaysia, or a more private part of England, given for putting it in LIC, which it obviously isn't, he caught the disease, and what polio does is it attacks and inflames your nervous tissue, which causes damage to nerves, prevents the development of limbs, so on and so forth. So if you do go onto the internet, look up polio, do a little bit of research, you'll find that the majority of the pictures you'll see will be of children with very obviously malformed limbs. obviously didn't include those pictures because of the Data Protection Act of 1998, and I didn't really want to have anybody ringing us up and suing us. Now, the person on the right here, this gentleman, is testing a pig for what I think we all had quite a bit of a scare if you read the papers, watch the news, and take them a little bit too seriously, of what's known as swine flu. Swine flu is basically the normal flu which infects humans, except it's adapted to pig swine, including the name. So, essentially, when it gets into humans, the effects are a little bit more detrimental. So, what has the UN done about this? I'm an MUN man, some of you may be. I thoroughly encourage you to do it. But the UN response was this. You can read that yourself. So in short, all this really is just sophistry, pretty superficial. It's them saying, yeah, there's an issue, yeah, we'll address it. What they actually do, I'll get to a little bit later. So who exactly are we looking at? What are we staring down the barrel of? What is Ebola? We all hear it in the news, we all hear people have it, it's a virus, yeah, this. But in truth, it's a very unusual thing. Ebola isn't a typical spaghetti virus. In fact, just by looking at it, you can tell that it's a sort of filamentous sort of body, and that usually is what's classified as a filovirus. Now, this is also a single-stranded RNA virus, and this only shares the filovirus category with one other disease, and that is Marburg. Now, Marburg is very similar to Ebola in the fact that they too are a happy couple in the filovirus family, as they only share this sort of long-stranded structure. Most viruses you look at will have a typical head capsule and sort of tailplate limbs that inject things, and then their DNA will sort of look curly, like you've dropped spaghetti on the floor. The RNA from this Ebola virus is string-like. It doesn't sort of really curl itself up as much. So how exactly does it get around? Well, to tell you the truth, it does exactly the same thing you'd expect a virus to do. It goes into you, infects you, straps on, uses your cell to replicate itself, and it creates virals. And what these virals do, as you can see at the bottom, please note that the virus shown here is actually the incorrect structure for the Ebola shown here, as I mentioned a few seconds ago. This is filamentous, these are sort of ball-shaped. And it reproduces by sort of creating little offshoots, sort of virals, and these will then go off into the body, into the person's bloodstream, other cells infect, and basically they become a walking package of Ebola. And there's a very specific protein which is expressed on the surface of this, and this is the EBOB glycoprotein, and that, in fact, is what allows it to fuse so well with the membranes of us, sort of primates. Coincidentally, well, not so coincidentally, considering that's what makes it so dangerous to us, this virus evolved in primates, and how it got over, I think we'll get to a little later. Although some have speculated that it is from the Marburg virus, but I wouldn't agree so much with it, as it's as I say, that it started from a common denominator, but then sort of like a tree of evolution of shots. And as you can see here, this isn't just a one-off, this is Catherine, if I'm pronouncing that correctly, which I hope I am. If there are any hematologists in the audience, you can correct me. And what this does is, this is produced by the bone marrow, and it allows the body to find and select the antigen that prevents the release of virus into the body. So virus that would normally exit the cell should be destroyed by monoclonal antibodies and such, but because of Ebola's inhibition of this, it means that you can't do it so well. Hence why it can travel so far and throughout the body. Of course, sorry. So this is obviously patients with Ebola, hence the title of my talk, Tears of Blood. And here you have some sufferers of Ebola. Notice how this fellow here, I think this might be William Cooley. He's actually in an almost coffin-like structure. And what this does is basically shield from the sort of virus particles that may become airborne if he coughs, sneezes, vomits, whatever. Up here, obviously, you can see the difference in facility. This patient is essentially lying on a bed. You can see the walls giving away here. When he coughs and splutters, I don't think he'll be too contained. I think that the whole room might become a little bit of an infection zone. So what symptoms do you get? As a whole, Ebola's not a very nice thing to catch, in case you didn't know that. But Médicos Sans Frontières, who are my favourite, who are also Doctors Without Borders, to those of you who don't do Spanish, stated that the symptoms are as such. You get a sudden onset of fever, feeling weak, muscle pain, headaches, and a sore throat. This is followed by vomiting, diarrhea, rash, impaired kidney and liver function, and in some cases internal and external bleeding, which you can actually see on this fellow here. He's not bleeding from his head, he's bleeding because his insides are leaking, essentially. The Ebola virus breaks down the connections between your cell walls. So essentially, as your aware capillaries naturally leak, you get some nutrients filtering out and pressure and such diffusion. However, if you open up those little holes in your capillaries a lot more, you divide the cells up, and all of your liquids freely sort of diffuse out of your blood vessels. Patients can bleed into their aortic cavity, from their aortic cavity, they can bleed into their stomach, they can bleed out of their eyes, the lining of their mouth will dissolve, they get diarrhea, etc., etc. I decided not to include some of the images from some of the more severe symptoms in respect for the cleaners. So when do these symptoms begin? These symptoms begin after about 4 to 10 day incubation period. So that is actually relatively short. If we're talking about something like AIDS, that scope's a lot more longer. So that means that a lot of people can get AIDS without anybody really knowing they have it. With Ebola, because the symptoms begin so quickly with the rash, the fever, one of the first doctors who got it actually noticed that he had a backache, even though he was sort of like early 30s, and that's sort of the beginning of the AIDS, that you sort of get things like backache and start getting a little bit worried about your appearance. Sort of started to notice these. So the first person who got Ebola, I'm thinking back now because I've got an extract to read to you, which I'm going to carry with me. So it's a man who was documented by Richard Preston in his book, The Hot Zone, which I wouldn't recommend to you. It's not particularly riveting or interesting Ebola and its emergence. But here it goes. So the man we're talking of is called Charles Monet. He's a Frenchman who sort of lives within DRC, West Africa, travels around a bit, doesn't do much. He's about 50 years old and is a sort of amateur naturalist person. And he wanders into cocaine, wanders out, and thinks all's fine with him. At this point in time, I'd like you to know that these stories sort of recounts and things told to Mr. Preston, who's an American author, so addresses with them with the usual overzealousness and fanciful elaborations. So here's his quick documentary recount of the symptoms in case you didn't hear me the first time. So the headache begins typically on the 7th day after exposure to the agent. On 8th of January, Moaning felt throbbing pain behind his eyeballs, decided to take home from work, went to his bed in his bungalow. Headache grew worse, eyeballs ached, his temples began to ache. The pain seemed to circle around inside his head. It would not give way with aspirin, and then he got severe backache. Note that the doctor I told you about earlier also got backache. His housekeeper Joanne was away, so he had a temporary housekeeper who tried to take care of him, but didn't really know what to do as his vomiting became worse. His face all appearance of delight had set itself into an expressionless mass, with the eyeballs fixed, paralytic, and staring.
The eyelids were slightly droopy, which gave him a peculiar appearance, as if his eyes were popping out of his head themselves. They seemed almost frozen in their sockets, and they began to turn bright red. The skin of his face turned yellowish, with starlight red speckles, and he began to look like a zombie. His appearance frightened the temporary housekeeper. She didn't understand the transformation in this man. His personality changed, he became sullen, resentful, angry, and his memory seemed to be blown away. He was not delirious. He could answer questions, although he didn't seem to know exactly where he was. He acted as if he had a mild stroke, and it's this final sentence that I find the most interesting. And that is because once you start bleeding, obviously, blood tries to clot. So if it clots in your vessels and travels around your body, it can get lodged in the lungs. Obviously, you've heard of people with DVT suddenly dying on aircraft because they've sat down too long and clot forms in their legs, it travels up to their lungs, the blood flow, they die. With this, they get multiple clots forming because their vessels are so leaky. The internal sort of system that even if you cut somebody up, it looks a bit slimy and mishmashy. This, it sort of becomes almost like worse, like mashed potato almost. Nothing quite has the same consistency. When later on they open up Francis Monet and they discover that his liver is completely shrunken. It's like he's been an alcoholic for all his life and really he's probably just a reasonable drinker. So blood leaks everywhere, clots form in your vessels, they travel up to the brain, and this is probably why he was acting the way he was, as if he'd had a stroke, because he probably did have a stroke. The blood clots had probably travelled up to his brain, gotten lodged, and caused mini-strokes, multiple mini-strokes, which would have killed the grey matter on the outside of his brain. Now, for those of you who don't know, the grey matter is sort of on the peripheral of your brain, and that is what defines you. The rest of you, the sort of autopilot, the one that keeps your heart beating, keeps your diaphragm going up and down, you breathing when you're not thinking about it, is what we call the white matter, and that has sort of things like hypothalamus, which allows sort of selective reabsorption of the water into your system by the sort of kidney nephron, those of you who didn't do GCSE biology, and looks after you in general. Now, without the grey matter, you essentially become a vegetable. You go into a sort of comatose, it's not quite a comatose state, you can more or less operate, but just not as well as if you did have your grey matter, because that's what makes you who you are, that decides your personality. It describes who your friends are, who you dislike. So if I'm a personal big lover of Sinatra. If I had a stroke, that might vanish, because that's part of what makes me me, my musical appreciation. So this, parts of Mr. Monet, I always call him Cloud Monet, but he's a painter, parts of Mr. Monet began to disappear. He wouldn't be able to enjoy things that he did in life, hence his general attitude and overall down-will, bad-will, sullenness at life, essentially. So people are scared of this disease, and so there are a lot of precautions that have to be taken. Essentially, when Cloud died, his remains were opened up, examined, and sort of looked at. However, because they didn't know that he was a carrier of this new virus, they tested him and thought that he had Marburg, which obviously is very similar, so using the same sort of ELISA tests, which sort of use marker antibodies to attach onto pathogens and sort of light them up. Instead, they thought he just had that, so weren't too worried when they opened him up, although he was mushy and very peculiar looking on the inside. But I got some instructions from 76 about how to treat a body that had died from Ebola attack. And so they're sort of approached sort of with caution, and they're washed with soap and water, as the virus tends to need a vector to transmit it. Obviously, those of you familiar with tuberculosis know that it's by droplet infection. If you cough on somebody, if you sneeze on somebody, you give them tuberculosis. Well, you don't give them, but you give them a chance of catching tuberculosis because you give them the pathogen. So if you do get Ebola diet for 76, it basically pops you into a plastic bag so that you're inside to enter the food chain, and then you infect all of the wildlife and create an Ebola quarantine area, which isn't very nice. But instead, they package it, so they just put you in the plastic bag after sort of cleaning you down with soapy water, and that's that. Cloud Monet was buried in a local hospital, sort of around where he was, around the DRC, sort of near that river. However, interestingly, when Mr. Preston came back to ask where the body was, nobody could remember. Draw from that what conclusions you will. But this obviously isn't enough for the current outbreak. Just to give you another scope of how this Ebola is different to the previous one, the UN actually said that all post-mortem investigations on a patient with Ebola or contacting somebody with Ebola must have to be done in a full spacesuit. You know, a spacesuit is, I'd like to say it was a spacesuit, but it's not quite a spacesuit, because then you'll think of Neil Armstrong. Now, a spacesuit it's like heavy-duty surgical scrubs, essentially, except I don't think they feel as comfortable as normal scrubs, because scrubs are like pajamas. But so imagine like a cross between scrubs and armor, biological armor. That doesn't make any sense, does it? But essentially, the scrubs that you wear have to be completely waterproof, because cloth, or nylon, I'm not familiar with what they make scrubs out of, is slightly permeable. You hear cases in hospitals of people bleeding so much that they soak through the scrubs. In these scrubs that you use when you contact an Ebola patient, you cannot have any blood soaking through them. And I promise you that with Ebola, you bleed tons and tons, you bleed buckets and buckets. One of the post-mortem investigators of Monet said that they were up to their elbows in blood. Another such example of this was before he'd even died, he was examined by a doctor who thought he had the Marburg virus and cut him open. Now usually what happens when you cut somebody open, you wait for the blood to clot and then you can sort of tie off vessels and things. But in this case, it was described as digging a hole underneath the water table. As soon as he'd made an incision, it instantly filled with blood. He made another incision, it filled with blood again. So they had to keep on using suction in order for this young doctor to see where he was. And kept doing that, but to no end, so he decided just to simply stitch him back up. After that, Cloud died pretty quickly. So, what's interesting though, and slightly grotesque, is that the doctor did look after Monet also caught Ebola often because Cloud coughed and vomited all over him. He didn't use the correct sort of gloves and things. He didn't protect himself, he didn't wear a mask, didn't know what he had. So who knows who this bloke is? Anybody? You at the back. William Pooley, that's great. You know where Mr. Pooley's from? Do you know where he's from? England, that's close. He's actually from Suffolk, in a place called Icon, Suffolk. As you can see up here, this is him before, during, and after he caught Ebola. Now if you look really closely, and the very astute among you will have, you'll notice that having Ebola cured him of his short-sightedness. That was a joke, by the way. So when you catch Ebola, I think that is the buzzword of today. Well, he's 29, I suffer, and like any good Welsh citizen, he volunteers as a nurse to go out and treat patients in West Africa. Goes out, treats patients in West Africa, promptly contracts Ebola. We get worried because he's a British national, and then fly over, bring him back to the Royal Free Hospital in London, and take care of him to the Royal Free Hospital in London. I expect it's not bigger than that picture shows. And we basically do cutting-edge care and deliver him with the latest pharmaceuticals. And these take the place. This pharmaceutical company created a drug which was called ZMapp from MAP Pharmaceuticals. And this drug is actually really curious because it's made from the tobacco plant. And the tobacco plant is primarily used in cigarettes, which kill you. Which which I think is kind of cool because something that kills you, then it saves lives. But anyway. So how's this drug synthesized? What they did was they gave the tobacco plant a modified tobacco plant virus. And what this virus does is it does a similar thing to Ebola. It breaks down the cell wall structure, parts of cells, so on and so forth. So they modified it a little bit, and surprisingly the antibody that came out of this plant worked effectively on Ebola. And this pharmaceutical company, bearing in mind, only had 9 employees. So these guys must have been good. So they gave this drug to this bloke here, Mr. Cooley, and to 2 other Americans, a doctor and another woman who didn't have a title, which was unfortunate, probably was a nurse as well. And they got cured. He's happily living at home after the summer, I think, and did a speech about his time with Ebola. And these are his direct words. I'm reading these out from a press release he did. I was worried that I was going to die. I was worried about my family, and I was scared, yeah. So he was airlifted out of West Africa by the RAF, and he was very much pains to show how far away the treatment he received in the UK was different to the treatment that he got in West Africa. In West Africa, as you saw earlier, the patients were sort of just lying there, not in any decontamination room. Here you can see UNICEF who are putting together beds. Now these beds, they're nice, they're doing something, but all in all these patients are going to be lying next to each other. They're all going to be sort of cross-contaminated. If any of them has a stronger strain of Ebola, they're going to give it to somebody else, which obviously isn't very good. But as you can see, it's like a spot the difference at the back of your morning box of cocoa pops. So who can point out any differences? Does anybody want to point anything out? More than welcome to. There's an interactive element to this in case you haven't already guessed. Well, for one, you can see that this is a very contained facility. People entering this will only do so by plastic gloves. They're not coming into direct contact with him, and at the end of the day, this whole facility, where it's going to work, can be incinerated. It can deliver drugs to him, whatever he needs. Here, this bloke is basically on an IV line. Probably doesn't have the best access to broad-spectrum antibiotics, which they'd have given to Putin, although I don't think that would do much difference considering it was a virus. But he's just lying there, pretty much probably being eaten alive inside while they tried to give him some fluids to keep him hydrated. These 2 people would probably have met a good 100 other people dressed like this, and so be absolutely covered with the pathogen. At most, they're probably using sponges to clean up around it. Probably not the iodine wipes which you'll see if you watch surgery. A lot of what they do before surgery is they wipe the area with a sort of tea bag iodine thing. So they go over it and it all looks sort of black and like somebody's tried to make a cup of tea with ink. But here it's probably just soap and water. So another drug that they developed which could fight Ebola was shown promising the prevention of the disease vesicular stomatis indiana virus. And just to be clear, that isn't a virus that goes after lost art or tries to find the Holy Grail. That's a virus that causes the flu in some sort of mice. So there are some sort of antibodies from that which could potentially be useful. But I'd also like you to note very much that there is no current license by the FDA or the NICE treatment for Ebola. It's not been licensed, it's not good enough. The drugs which they gave Cooley and the 2 other, the doctor and the nurse from America, barely passed testing on chimps before it was administered to them. So who are the culprits of this disease, this horrible thing that creeps up on us in the middle of the night, makes us cry blood, makes us feel as if we're made of shards of glass? The answer is, of course, fruit bat. As you can see, I'm a sucker for cheap jokes.
And what the real problem is over there. These are real fruit bats, by the way, in case you didn't notice. And fruit bats are horrible. Why are they horrible? Because they're mammalian like us, which means they'll share more of their DNA with us than reptiles, insects, and whatnot. But also because they congregate and they are friends and they throw huge house parties and then stay over at each other's houses and then pass Ebola between them. So if one of them gets infected, say by something that was infected with Ebola, then essentially you're going to get huge numbers of Ebola-infected bats. And that is not good because bats migrate. And the migration of bats means that Ebola can essentially fly across borders. The quarantine you put in place doesn't apply to bats. Bats just want to follow their natural rhythm. They want to go and hibernate, they want to feed, they want to mate, they want to fly around. Whatever it is that bats do, fight for justice, any of those things. But where did the virus evolve? These guys are essentially just little, they're just little like cars, they just transmitted across their lorries. Interestingly though, they don't exhibit any symptoms. Now why is that? Fruit bats, specifically African fruit bats, the European, American fruit bats there aren't any fruit bats in Europe, but American fruit bats haven't had any but these guys don't bleed to death. These guys instantly drop out of the sky in mid-flight and shower down. And that is because bats have a super cool, super strong defense system for their DNA, because when you're flying, you need a lot of energy. And a byproduct of normal respiration reaction is heat. Overzealous and enthusiastic as always. So this heat, this heat raises their body temperature to 40 degrees and produces lactic acid, as somebody said over there, and I think some other nasties. And these all act against DNA, which is great. So over time, through the evolution, natural selection, etc., bats have developed this super strong immune system, which means Ebola gets into them, but it can't sort of latch on and do horrible things, cause them to bleed out and vomit and form a rash. Although I'm not sure what a rash would be like on a bat. So they transmit them across and give them to humans while they themselves don't feel anything, which I think is a little bit unfair. But Ebola doesn't begin here. We have to move one step back. And as we move one step back, we begin, you guessed it, at this little fellow up there. Who thinks he looks quite cute? I think he looks a little bit cute. Do you? Anybody? Yeah? It's quite cute. This fella is a West African green monkey, and you can tell he's a green monkey because of his bright green fur. That's my little jab at the people criticizing him.